I have thankfully never had a patient have this, but I have heard of patients that have had blood clots and it's gone to the lung. So that's what we worry about more. The DVT idea is not as stressful. The idea of the blood clot going somewhere else is a concern. And that's why it's going to be really important discussing this situation because in there's other athletes that have had this, even basketball players in the last few years, and those were a lot of them were lower extremity, so the leg, which is much I see much more commonly. This was in the shoulder.
Yeah.
So how many shoulder blood clots do I see a year? Maybe one if we're lucky. We actually saw them increase a little bit with COVID, but this is not related to that. But upper extremity blood clots are very uncommon. They're actually more common in athletes than anybody else, but they're just not common. And so one of the thoughts here, we can go into this in a minute, is how did he get this, right?
Yeah.
What size? Was it another diagnosis, something called thoracic outlet syndrome? If you read some of the articles, again, we don't have a diagnosis yet.
Yeah.
The number one thing is to get the blood clot out of there. So not with surgery, but to thin it out. But anyhow, so I can go off on this in a second, but this is a big deal because obviously he's out for the season.